So we did our presentation on the advancement of medical technology. So I'm going to talk about the medical technology in the past, specifically the origin of X-ray imaging and the electronic medical record. So this is a timeline showing some of the major events at the Hospital of the University of Pennsylvania regarding the development of radiology. In 1890, Arthur W. Goodspeed, a physics professor, and W.N. Jennings took the first X-ray image at UPenn. In 1897, the Division of Röntgenology Services opens at HUP, and this was part of the surgical department. It wasn't its own department yet. It also wasn't referred to as radiology. It was Röntgenology as a tribute to Wilhelm Röntgen, a physics professor in Bavaria who is credited for discovering X-rays. In 1904, barium was used in radiology studies. Barium is a white liquid that outlines the digestive system in X-rays and allows physicians to better visualize abnormalities and make more accurate diagnoses. In 1939, the Department of Radiology broke off from the surgical department and became its own. In the 1950s, this was when there was the first use of emission tomographic scanners, which led to the development of CT scanning. CT scans combine multiple X-ray images taken at different angles to make cross-sectional images of the body. In the 1970s, this was when the first fluorodeoxyglucose PET image was taken at HUP, and this type of scan detects metabolically active tumors, cancers in different parts of the body. So X-ray use and patient care. At the time, X-rays were majorly used to identify ingested foreign objects and fractures and breaks in the bones. It was believed there was no dangers to be cautious of, which obviously now we know that's not true. Early radiologists would put their hand directly into the beam of X-ray light, looking for their hand to glow to check if the amount of light exiting the tube was adequate. This type of exposure and the lack of precautions ultimately led to complications and death of patients and healthcare providers, unfortunately. So this table shows the use of X-rays at HUP as a percentage of patients having an X-ray taken. So the use of X-rays did not substantially increase until the first quarter of the 20th century. So you can see in the table how the percentages don't really increase until 1920 and 1925. This is attributed to the change in personnel who operated the machine and the use of the medical record. So from 1897 to 1909, the machine was run by the chief medical resident, who had many other responsibilities on top of operating the machine. In 1912, the position shifted to David Bowen, a radiologist, so his only responsibility was operating the machine. Having a working X-ray machine in the hospital solved many issues regarding travel. At the end of the 19th century, beginning of the 20th century, the US was a rural country without many paved roads or automobiles. So for patients with broken bones or other injuries, it would have been really difficult for them to travel to somewhere with an X-ray machine after going to the hospital. So having an X-ray machine in the hospital allowed them to, if they were already admitted, get the X-ray while they were there. They wouldn't have to travel to somewhere else. So the sharp increase in X-ray image usage is also attributed, in addition to having an X-ray in the hospital and the change in who ran it, it's attributed to the development of patient record keeping, as test results and images produced became extremely helpful to healthcare providers when they were filed. It was realized that the information that an X-ray image could provide was really valuable to store in a patient's file to better care for them now and later in life. So looking more at the development of the medical record, in the 19th century, patient records were kept for educational purposes rather than patient care, so they would be used as case studies, for example, to teach medical students. Early in the 20th century, patient records included the patient's medical history, diagnostic imaging and test results, and notes from the physician to better care for patients. Mid to late 20th century records were handwritten and filed on shelves, which is much different when you think about how they are now. But at this time, it's when healthcare providers realized the value of using this information and organizing it in a way that they could holistically care for their patients throughout their lives.
So now going into medicine in the present, and again, focusing on X-ray imaging and the electronic medical record today. So there are many different types of X-ray technology today used for a variety of different purposes. To consider the main and major types, they're radiography, computed tomography, so CT scans, dental cone beam computed tomography, fluoroscopy, and mammography. And on the right here is an image of kind of what an X-ray machine, one of these X-ray machines looks like today. And so in comparison to the image that was seen on the previous slide when talking about the past in X-ray technology, there is a very, very big difference that I can see. And there's a lot more technological based factors and overall just a better kind of machine that can be used to read X-rays and this radiological images. So when focusing on the impact, there is definitely a very, very big impact that this has had on medicine today and in comparison to medicine in the past. And so Dr. Paul Ellenbogen, who is the chair of the American College of Radiology, has said that deaths from cancer and other serious illnesses and injuries have plummeted in recent years, largely due to early diagnosis that is made possible by imaging exams. Additionally, the breast cancer death rate in the United States has dropped more than 30% since mammography use became widespread in 1990. And so this is huge because there are certain deadly illnesses such as cancer, which are such big things, can really be not, if not 100% cured, very easily curable because these cancer, for example, sicknesses such as cancer are detected very early with this technology. And so the proper treatment plan can be made to help the person survive and overcome the illness that they could be facing. And so again, to talk about the benefits of these advancements in medicine, X-ray imaging exams are recognized as a valuable medical tool for a wide variety of examinations and procedures. They're used to non-invasively and painlessly help to diagnose disease and monitor therapy, support medical and surgical treatment planning, guide medical personnel as they insert catheters, stents, or other devices inside the body, treat tumors, remove blood clots and other blockages, etc. And so not only for certain things like cancer and tumors, but also for blood clots and maybe if there's a sprain, a broken bone, whatever it is, these radiological advancements can be used for it to really help a person get better, go through therapy, go through whatever treatment that they need to go through and return back to normalcy. And so this X-ray technology is it's a very, very big part of medicine and healthcare today. So now talking about the discovery of the electronic medical / healthcare records. So previously it was seen that the EHR was all paper-based, kind of filed away in long closets or storerooms, but now an EHR is a digital version of a patient's paper chart. They're real-time patient-centered records that make information available instantly and securely to authorized users. When healthcare providers have access to complete and accurate information, patients receive better medical care. These EHRs can improve the ability to diagnose diseases and reduce or even prevent medical errors by improving overall patient outcomes. So when focusing on the change to healthcare, specifically looking at statistics, 94% of providers report that their EHR makes records readily available at any point of time through care. 88% report that their EHR produces clinical benefits for the practice. 75% of the providers report that their EHR allows them to deliver better overall patient care. And so when looking distinctly at what this EHR has, it's kind of a summary of, initially focusing on the chief complaint or the CC of the patient, then going into the history of the present illness. So talking about the quality of it, the region, any radiation, its severity, the timing of it, any associated symptoms, the context, and then also going into the review of the symptoms. So including positive and negative symptoms, what the patient is experiencing, and also what they're not experiencing. And then also talking about the health status, if they have any allergies, any past medical, family, or social related history that may influence their health. And then also treatment plan factors for the future. So this could be therapeutic, diagnostic, and educating the patient while also listing any follow-up appointments that could be needed. And so everything here is kind of in one spot. If the patient has seen a different provider in the past and been prescribed a different type of medication, and now this patient goes to a different provider, that different provider can see what happened to this patient in the past. And so everything is kind of just in one spot, and this prevents the provider from having to surf through a bunch of different files or go through a bunch of different pages. They can easily just type up a person's name, search them up, and everything is just there in one spot. And so because of all of these reasons, the EHRs can aid in diagnosis, they can reduce errors, improve patient safety, and support better patient outcomes. They can improve public health outcomes. As mentioned, it can help go paperless, so support the environment and exterior factors. And also, as mentioned, it's very, very easily accessible. At the right here, it's pictured kind of like a visualization of what the EHR is, and you can see like lab screenings, kind of everything is just put into the one screen. So as mentioned, everything is just kind of in one spot, making medicine super, super easy today in comparison to the past.
Some of the technological advances in the future of medicine include robotic surgeries, less invasive procedures, more safer machines, and accessibility to a greater population. So the first medical imaging technique to be used in the future could be virtual reality and 3D imaging. So virtual reality has applications outside of video games, as 3D imaging in radiology takes us one step forward and allows doctors to use MRIs and CTs to see a complete and accurate image of one's body. Now, one of the specific techniques is called special imaging eyewear. So these are essentially 3D scans that provide a more detailed inspection of a specific body part. And this could also be printed using a 3D printer to provide a better visualization. And this 3D imaging work and digital reality will be an immense technological advance in the healthcare field. As current CT scanners range in millions, not a lot of hospitals and healthcare facilities are able to afford it. That's why they have CTs and other medical imaging in short numbers. But if the 3D imaging is created to be less expensive, then more healthcare facilities will be able to afford this technology and provide better and faster imaging for patients. The second medical imaging technique to be used in the future could be artificial intelligence, or more commonly known as AI. Now, this is a tool that analyzes massive amounts of data by using a software that creates algorithms. AI will reliably predict problems when introduced to patient data and identify potential complications in specific areas of the body. And this will save immense amount of time for radiologists because they know exactly what to look for. And it will also concentrate on that particular area. So AI is able to spot potential problems that aren't apparent to the naked eye, so it ensures that the diagnosis is more reliable. Now, according to DataBridge Market Research, the compound annual growth rate of AI-based technology in medical imaging is likely to rise by 36.89% by 2026, which is in 5 years. And that's a value of nearly $265 billion. So this is a video by The Economist that will focus more on artificial intelligence and in the overall future of healthcare.
Tasks better and more efficiently than humans.
We've got to actually say hello to it.
Today, AI has come of age. It's already having an impact on many parts of human life, from self-driving cars to finding soulmates. But perhaps its greatest impact will be on medicine and the way we monitor human health. Dr. Eric Topol is one of the most influential doctors in digital medicine. The pioneering American cardiologist has helped develop drugs that have saved countless lives. He's now at the forefront of the AI revolution in healthcare. These are his prescriptions for transforming the future of human health.
The overarching goal is to bring back the humanity. If we do this right, we can rescue the problems of healthcare.
The doctor-patient relationship is a founding principle of healthcare and medicine.
The first step is to eliminate keyboards and computer screens in clinical encounters.
Some doctors in the West can spend up to twice as many hours on medical paperwork than with their patients.
In the years ahead, we should be able to eliminate the data clerk functions of clinicians. These are mutually hated as much by patients as by doctors and clinicians.
AI tools, such as speech recognition technology, that are now commonplace in homes, could be used in clinical settings for capturing data and notes, allowing doctors to concentrate on people.
As seen, the future may exclude the need for providers taking out time for EHRs completely. Today, providers believe that EHRs have made their lives easier, but in the future, they wouldn't even need to take out time for it at all. Again, medicine is becoming easier, more efficient, and more effective with time. The third medical imaging technique is called deep tissue imaging. This is able to view cellular functions deep inside the body, which we're not able to do right now. It will design cells to produce air-filled proteins to make them easily noticeable in ultrasound images, and it would also make it easier to monitor them over time. Now, this is visible in the image as the right side uses this deep tissue imaging technique, and compared to the left side, we're able to view the cellular functions more better, and they're more visible to us. It could also be used to analyze how cancer cells behave, and it would be a great advancement in that field. So with these technological advances, no one's jobs are truly safe in the future. Experts say that robots are the future, and as businesses see this as a long-term investment, they might go towards this path, and jobs will go away as robots slowly take over everything. An example of this in the healthcare field is from the iCAD's Profound Artificial Intelligence, which is a solution for DBT. It allows radiologists to see each tissue layer more clearly, allowing them to spot cancer up to 8% earlier. This saves radiologists up to 50% of time that they spend reviewing breast scans. And with more advances in the future, AI may even take up more than 50% of the workload. Now, this sounds amazing, but with this, the future outlook of radiologists may decline because their need in the field may decrease. Also, robot-assisted surgery already exists, but what if in the future robots perform surgeries independently without the need of a large surgical team? Because robots could potentially have more than 2 arms, extreme precision, medical imaging abilities, microscopic eyes, and much more. So they're able to do anything that we want them to. As robots and machines take over, only a small population of individuals may have to work in the future. These are our references. Thank you.